So now this is the kit. Everything's in here. Just put it here for now. This is your extra gel if you don't have any gel in there. So, which I already did. Now, this is an extra one if you don't have any for the patient or whatever. Okay, it already comes with everything. And this is the sterile gloves. And before I put on my sterile, I want everything that I need already in there, because once you're sterile, you cannot ask somebody already to get one for you. We use this Tegaderm for a patient that has sensitive skin. I don't know if you guys ever seen this or used this at all, but a lot of our patients are very sensitive. They have a rash in there or redness and stuff. So what we do, try to eliminate it, is to try this IV3000, which is more for hypoallergenic. So that's one that you can just add in there. And then I just press everything in here. Okay. Now I'm ready for my sterile. This one is one size fits all. A little bit big still for me.
And please get the right size gloves for you. It's just that we can't put, you know, a size for every single person in there. So it's meant to.
If the patient is able to move her arm, then we can always ask the patient, can you please move your arm up? And I put this under the, just put it up. Put it under the skin. There you go. And then all your stuff, it has the body patch already. This is the skin prep. Just in case you need some Steri-strips. This is the chlorhexidine. The one that doesn't come with the kit is a sponge. It has orange type tinted. I don't know, for some reason, other patients are sensitive to that than this. I think what we probably realize is probably the tint color that causing the irritation of the skin.
It's just kind of like food color.
So that's why we don't use that, and we use the clear one, because this is very clear. The only reason why we use the color is that you could tell how far have you cleaned the arm. It tells you right away the color. This one, you barely can see it because it's clear. So I'm ready to clean. There's supposed to be So again, this is not betadine. We just scrub it for at least 30 seconds or so. They want the friction. That's the most important part, is the friction. At least 2 to 3 inches from the side as well that you can clean. And what I do also, because if you really want to be really sterile, I don't even touch the hub or anything like that. I use this 4x4 to hold this in here, and that's what I use to clean this. The wings and the catheter that is out. Because again, this one was exposed outside, so you don't want to touch that part. Then I use it again to scrub for outside. Then we use 3. Some patients still also are sensitive to this chlorhexidine, so what we use is the betadine swabs. So you can change that to the betadine, and we see some difference on the patient's skin. So
is this like alcohol? And
it's a chlorhexidine, it's a chloroprep. Yeah.
It's chloroprep, so it's like it has chlorhexidine in it and alcohol.
Okay, and the most important again is really completely drying it, because once we cover something that is wet, that causing a lot of our patient has a lot of skin sensitivity, and they come and get a lot of rash and redness. So I think sometimes it's covered and it's still moist inside, especially it's chlorhexidine, it's chemical and can cause a lot of skin irritation. So once it's completely dry,
Anywhere from 30 seconds to 5 minutes.
so Craig, you don't get a sterile gauze to help it
No,
dry?
you have to let
you
it
don't
air
dry, just let air dry without
Okay.
blowing or anything.
Okay.
Yeah.
So unfortunately, maybe up to 5 minutes.
So that's why it takes you a while. Then after it's completely dry, it's very important also that you put the skin prep pad, because when you pull the thing, you're not pulling the skin as well. You're protecting the skin from getting irritated further. So then again, we just do this from the inside to the outside.
So the Tegaderm, the clear dressing that we use, actually is an acrylic adhesive. It's a very thin acrylic adhesive. And under the electron microscope, they've taken it off and it kind of takes some cells with it. And once you start taking cells with it, you disrupt the skin. And then you add chloroprep and everything to it, the skin just gets worse. So please make sure that you use the skin prep.
So once it's completely dry again, now we can go ahead and put the wing. So we usually connect all this first before you, before you apply it to the skin of the patient, because you don't want to push it in there as well. So you might want to do it this way. And then once that's completely dry, then you can just pull one side, just do it like that. Or if you want it down below or to the side, it's up to you. Sometimes if we have a skin that is already irritated down there, we try to rotate the side so you don't need to keep putting the same place over and over. And sometimes it's a patient preference, oh, I want it this way, I want it this way, so we just go whatever they say. And then this is now your bye patch. It's always the shiny side up, if you want to remember that, which one goes first. And this is your slit, which it goes in there. So when you remove it, it's a lot easier. Because if it's this way, you're going to struggle. You're going to pull the catheter. And then that's about it. And then you're ready to put your Tegaderm. Again, there's a slit, so that's where the slit that goes into the catheter there. If possible, we want to cover the entire, what do you call this, cystot lock. There you go.
So how often do you change this? 2 days, every 2 days, 3 days?
7 days.
7 days.
Unless it as needed. The skin is,
I see.
if the dressing is compromised in any way, we need to do it again.
And if the skin is irritated, we see a lot of patients that the skin is even draining already, then do not put Tegaderm because it's just going to get worse. What we do is we wrap it with gauze and Curlex, and they need to come every 2 days until that skin is healed. Because if we keep putting this, the more it's not going to heal. So for a gauze, it has to be every 2 days.
So Curlex roll and then A-strap? No more. Just the
Just
Curlex roll.
Curlex, yeah. But we still secure that and everything except that there's no Tegaderm. We're just using the Curlex. And then sometimes what I do, I just more secure it right here so it won't come off loose, and put one underneath there too. Whatever. Sometimes patient preference as well. There you go. This one has to be clamped at all times. Then we do the cap chains. You can use the 2x2 gauze that comes with this to remove that. Clean it with the alcohol.
And the cap is already in the kit?
That's
or
the thing
we
that
have
you
to
need
order?
to add to. You need to add that. But we do a lot of dressing and blood draw at the same time as well, so we got everything already on that on our saline flushes.
So, Craig, do we need to stock?
You should stop the cap.
Yeah, because